All right, so welcome everyone from wherever you are joining us from. I see some that I know, some names that I know that are actually even overseas tonight. So that's really exciting. Maybe you're on the West Coast, it's a little earlier in your day. My name's Justin Vogel. I am the director of IAHP and digital programming. Really excited today for another In Touch presentation. Well, for me tonight, it'll be lymphatics, evidence-based knowledge for the manual practitioner with Dr. David Doubblestein. I'm going to tell you a few things about the In Touch series. This may be, if it's your first time attending any type of event with the Upledger Institute International, welcome. We hope we can tell you a little bit about all the different things that we do, and you learn a little bit from this, and hopefully we can connect with you more often in the future if you're a manual therapist and you're just now finding the Upledger Institute. So I'll get us started here now that the entrances have calmed down a bit. One thing that I started off with saying, and some of you were not here yet, that if you'd like to review, we do always post all of the In Touch presentations to our Facebook page, the Upledger Institute International Facebook page. That page you can view that whether you're a member of Facebook or not. You do not have to be signed into Facebook to review or to view this presentation later on. So also, I mentioned that if you've registered, if you're here within the Zoom, you've definitely registered, or else you wouldn't have been able to enter the room. So that will prompt our team to send you an email with the recording later on as well. So thanks everyone for being here again. A little bit about the In Touch series. I see some familiar names that have been here quite often for some of, or many of our presentations. But again, if this is your first time here, we created this series to do a few different things. Anyone's welcome. We hope that our topics are suitable not only for manual therapists, but they can help a layperson. Maybe you have a client that later on you wanted to share this with because maybe you're working with lymphatics and it would be something that applies to them and you think it'd be a good educational tool for them. So it's a series of virtual presentations by teachers, developers within our institutes. Stay in touch with the latest information pertaining to our manual therapies and enhance your health and the health of your clients. Each Zoom presentation, forgive me if you see my cursor going across the screen here, I still have a few more coming in, which is great. So it's good I take this couple minutes and they won't miss any of Dr. Doublestein's presentation here. What I was going back to my point is each Zoom In Touch presentation has its own code. So it does require that you have your email address logged in with Zoom. But other than that, each time you'll register with a unique code, and our team does a good job of emailing and or you can always email me, and also the website you can always register at the Upledger Institute International website. Dr. David Doubblestein is an assistant professor in the Doctor of Physical Therapy program at A.T. Still University, Mesa, Arizona. He received his Master's of Science degree in Physical Therapy from Grand Valley State University and his doctorate in Philosophy in Physical Therapy from the University of Michigan, Flint. He has predominantly worked in outpatient clinical settings, including his own private practice. Dr. Doubblestein is a LANA credentialed certified lymphedema therapist, a board-certified clinical specialist in orthopedic physical therapy, and a certified McKenzie therapist. Dr. Doubblestein has taught CLT coursework from 2005 to 2022 through Chickley Health Institute, Upledger Institute International, and the Academy of Lymphatic Studies. David is the Vice President of the Lymphology Association of North America. He is passionate about lymphology as it extends across all disciplines of physical therapy and fields of medicine. He is the author of the book Manual Lymphatic Techniques for the Orthopedic Manual Therapist. His research interests are in lymphology, lymphatic disorders, and orthopedics. Dr. Doubblestein's research interests have focused on lymphology education and cancer-related lymphedema. He has published several articles related to this topic and continues to progress toward knowledge translation of his findings. He is also spanning his research interests of lymphology into orthopedics, where he is investigating the neuromuscular effects of chronic edema. And now I'd like to hand it over to you, Dr. Doubblestein. Thanks so much for being here with us.
So thank you so much. I'm glad to be here today. What a pleasure to be with Upledger again and do a little presentation about lymphatics. And I hope to stimulate your interest in the world of lymphatics as it drives me every day to do more and more and know more and more about lymphatics. Today, we're going to talk about lymphatics, and we're going to be basically going over the lymphatics and looking at the evidence-based knowledge that's related to the lymphatics, and we'll look at that from anatomy and then also a little bit about physiology, and then we'll go into some practical applications as well. So this is for the manual practitioner. Just want to make sure I got my highlighter here, laser pointer. Let's see here. There we go. Got it. All right. So I am the author of a book called Manual Lymphatic Techniques for the Orthopedic Manual Therapist, and that is published by Upledger Institute, and you can purchase that book through them. I have also a number of peer-reviewed publications as well as non-peer-reviewed publications, as you can see here, so you can look me up that way as well if you're interested in knowing the research that I'm doing currently. A lot of it is about outcome measures because we need to get more research and outcome measures for the lymphatic system and what we're doing with that. So as was mentioned, I'm an assistant professor for A.T. Still University for their doctorate in physical therapy program here. And I wanted to start off by helping us know a little bit about the lymphatic system from A.T. Still. A.T. Still is the founder of osteopathic medicine. So when we think of DOs, doctors of osteopathic medicine, we think of A.T. Still. And A.T. Still University is founded by A.T. Still himself. And he was very interested in the lymphatic system. In fact, you can see here some of the things that he wrote. He says here, we strike at the source of life and death when we go to the lymphatics. So that is certainly a significant statement to say. Also down here, no space is so small that it is out of connection with the lymphatics, with its nerves, secretory, excretory ducts. This system of lymphatics is complete and universal in the whole body. So we can know from a long time ago when A.T. Still was doing his practice that lymphatics were certainly important. So that brings us to the question, what is the lymphatic system? For those that are new to lymphatics and the practice of lymphatic drainage, I want to make sure that we go through enough anatomy and understanding of the lymphatic system and physiology so you can apply it to your practice with whatever modality you're doing that stimulates the lymphatic system. We'll get to that in a little bit. So first thing I have to make sure that you understand is that the lymphatic system is a major body system. Unfortunately, a lot of physiology books really don't highlight the lymphatic system as a major body system. A lot of times they put it as a component of the cardiovascular system or as a component of the immune system, and they talk about it briefly. You might see a paragraph or two in a physiology book. Right now, I teach applied human physiology, and that's the case with our applied human physiology book. It doesn't really get a lot of quality and quantity information in these books. But it is a major body system. It is associated with the cardiovascular system, and it is also associated with the immune system. But in and of itself, it's its own major body system, and it functions independently from them. This lymphatic system is made up of different sized vessels, and it has lymph nodes, and it transports lymph fluid through those vessels and nodes. And it's really significantly important for the interstitial and cellular environment and the homeostasis and health of the cells that are there. So where do we find the lymphatics? That's always an important thing to know to begin with. And a lot of the lymphatics are basically throughout the whole body, if you will. There's really not too many places that we don't find lymphatics. So anywhere there's the circulatory system that are supplying the cells with nutrition and oxygen, water, and things like lymphocytes and chemical mediators, all these things that the circulatory system is providing for your cells. If you find the circulatory system, especially this microcirculation, you're going to find with it some lymphatics. So basically, lymphatics are everywhere there is blood. There are some exceptions and where we don't find not blood, where we don't find lymphatics, excuse me. That would be the epidermis or epithelial tissue. We don't find it in cartilaginous tissue. Maybe the outer surface of cartilaginous tissue, there's a little bit of blood supply there, but as we get in closer to the center of the cartilaginous tissue of bone, we don't find lymphatics there. The cornea and the sclera of the eye, we don't find lymphatics in the nails. And also the labyrinth of the inner ear, we do not find lymphatics there. But otherwise, we find lymphatics everywhere, and that's superficial and it's deep. We'll get into that a little bit later. So let's just go over some basic components of the lymphatic system. The first thing that we need to understand, if we're going to talk about the lymphatic system, we have to really understand the cardiovascular system. And so with the cardiovascular system, we know that it is a closed loop system, if you will, meaning that your blood pumps from a heart, right? It has a single pump, and it's your heart, pumps blood out, and it goes to either the pulmonary circulation, the visceral circulation, the systemic circulation. And it goes there and it goes into the microvasculature of that. And so it goes through this capillary network and it goes through a process of filtration. And in some books, and we'll talk about this in just a little bit, some books also talk about reabsorption. So going out, coming back in, going out, coming back in. So what's going out is nutrition and water, your leukocytes, lymphocytes as well, all these different components that are in the blood going out to the cells to help bring nutrition and oxygen to the cells, and also for the lymphocytes to help defend the cells and so forth. And then what happens there, then the blood returns back to the heart and it circulates again. So blood is constantly circulating. And that's the basic components of the circulatory system. But that lymphatic system is different. It is a one-way system, and it starts from that cellular environment where the cells are, and it transports lymph fluid with waste products back to the venous system and then to the heart. So it comes back to the veins, and then the waste products and the lymph fluid mixes with the venous blood, and then that goes to the heart. And then those waste products, and then we'll go to the organs of elimination, such as the renal system and the bowels and lungs, skin, all these organs of elimination, liver, and that's how we get rid of the waste products. So what's really important here is this microvascular exchange, this exchange of nutrition and water and waste. And this is where we're going to find this lymphatic system beginning. And as it sends or transports the lymph fluid through these lymphatic vessels, they go through lymph nodes. This is where we get this filtration of the waste products. We reuse some waste products if we can reuse it. The body knows how to reuse it, and otherwise the rest of the waste gets eliminated out of the body. So some things to keep in mind about the lymphatic system as far as what makes the lymphatic system different than the cardiovascular system, right? Well, a couple things here is that it has a low volume. It only transports about 4 liters per day. Compared to that, the multiple gallons of blood that goes through the cardiovascular system. It's also a slow rhythm, about 5 to 15 beats per minute. So most of us have a heart rate that's about on the good end, 50 beats per minute to maybe 80 beats per minute at rest. And so you can see here how much slower the lymphatic system is in transporting this lymph fluid. The other thing is that the lymphatic system has capillaries, and these capillaries have these large openings called fenestrations. We'll talk a little bit more about those fenestrations when we get into the anatomy, but the thing to understand here is that they're larger fenestrations or openings than the capillaries have of the cardiovascular system. It also absorbs large toxins and proteins. So because there's these large fenestrations, they can absorb proteins and toxins. Another key component to this is that the lymphatic system has lymphangion muscle pumps. So they have muscle pumps along the vessels in multiple segments. That is much different than the single pump that we have in the cardiovascular system. We have a large heart muscle pump that pumps the blood, and here we have multiple lymphangion muscle pumps. Again, we'll get into that a little bit further later on. You'll hear me say often that it transports. That's because the lymphatic system does not circulate lymph fluid. The lymph fluid does not go out and come back and go out and come back like blood does. This is a transportation. So it starts from the cellular environment and transports lymph to the venous system. Another thing that's really important is to understand is that it's transporting not just lymph fluid, but it's also transporting lymphocytes. Lymphocytes are part of the immune system and a significant part of the immune system. And we'll talk a little bit about that again. All right, so let's get into the evidence-based aspects of anatomy. What do we know about anatomy? What can I tell you about anatomy that's evidence-based? So the first thing that I can tell you is that we'll start our journey actually in the tissue spaces rather than the vessels, because in the tissue spaces, the cells live in an interstitial environment, and this interstitial environment is mainly a water environment. And in this water environment, the water will have waste products in them. And this water with its waste products will then need to gather, if you will, and then start leading towards the initial lymphatic capillary. So the way that that's done is called pre-lymphatics, or what we call tissue channels. And this is where water, which is the main component that we are interested in, but it also has proteins and other colloids or waste products, we could call them, and they're being drawn towards the initial lymphatic. So that first vessel component, the initial lymphatic, also called a lymphatic capillary. These are unorganized pathways. They're very, very small, but this is a way of channeling the fluid towards the lymphatic system into the lymphatic capillary. So now that we know how that water can get to the initial lymphatic or lymphatic capillary, let's talk about those main components of the lymphatic system. So the main components are the initial lymphatics, which we also call the lymphatic capillaries, the pre-collectors, and the pre-collectors are important, and they consist of two different kinds. So the first kind is what we just call the pre-collector, but then they also have something called a perforating pre-collector. Perforating pre-collectors will perforate through the fascia to connect the superficial to the deep. We also have collectors. Collectors are the main component that propels or transports lymph. Collectors are basic collectors, but then collectors can become larger when they anatomize, and they become trunks, and then the trunks will anatomize and make a duct, if you will. There is a right lymphatic duct and the thoracic duct. And then, of course, there are also lymph nodes as part of the main components of the lymphatic system. So now that you know the four main components of the lymphatic system, let's go over each of those really quickly. So the first one is the initial lymphatic. The initial lymphatic is also called the lymphatic capillary. The lymphatic capillary is made up of single layer endothelial cells, and they overlap each other. They look like oak leaf shaped, if you will. They have a oak leaf shape to them, and they overlap each other. And that's really important because that overlapping makes this flap valve, if you will, that allows the water and the proteins and the colloids to come in. Remember, these are larger components. These waste products are larger components that can come into the lymphatic capillary. The lymphatic capillary is then connected to the interstitial environment by way of these anchoring filaments. So you can see here I have a lymphatic capillary or initial lymphatic here. From these single layer endothelial cells are these anchoring filaments, and they connect to different tissue components in the extracellular matrix. So the extracellular matrix will have uh, components like fascia, there will be some nerves here, there's fibrinogen here, and they'll connect to the interstitial environment. What happens then is these anchoring filaments will get pulled, and when they get pulled, it opens up these flap valves, if you will, or these junctions to allow the interstitial fluid to come inside the lymphatic capillary here. And so this is really where the lymphatic capillary is where lymph formation occurs. So lymph formation occurs in the initial lymphatic. So that brings us to the question is, what is lymph then? Well, we say that lymph is made up of a lymphatic load. A lymphatic load consists of water, protein, and long-chain fatty acids. Your main constituents are water and protein. But there are a lot of other things there too. You have hyaluronic acid, you have cell fragments, you have lymphocytes, you have also leukocytes will get in there too. And there's different kinds of waste products that are in the cells, that are in the interstitial environment. Different things like enzymes. You have different chemical mediators, bradykinins, cytokines, different things like that are part of that lymphatic load as well. And so that's what's getting drawn in, or if you will, vacuumed into the initial lymphatic capillary, lymphatic capillary, if you will. The next picture I have here for you, this is a cross section of the initial lymphatic or the lymphatic capillary. You can call it that as well. You'll see here the anchoring filaments. I like this picture because what you can see here is the gray arrow, and you can see as the anchoring filaments are being pulled, it opens up these flap valves, and this interstitial fluid that surrounds the cells, the interstitial fluid is being drawn into the lumen of the lymphatic capillary. As that happens, so before I get to that, there is a negative pressure inside here that helps to draw in this interstitial fluid. As that happens, the pressure begins to build up and we get a positive pressure. And you can see here the clear arrows, the white arrows, are pushing against the wall of these single layer endothelial cells. And what that does is it closes the flap valve. When that flap valve closes, a little bit of water escapes. So the question then is, what's really the difference between lymph fluid and interstitial fluid? So you have interstitial fluid around your cells. Inside the vessel, the lymph capillary is lymph fluid. What's the difference? Well, the difference really is the osmolarity of the fluid, and so it's more condensed inside the lymph capillary. And so this is where we say that there's a lymph formation. Okay, so from there, the lymph fluid then travels into the pre-collector and or the perforating pre-collector. These are a little bit more structured. They have 1 to 3 layers of endothelial cells. The interesting thing about this is that they have these bicuspid valves beginning to form, and these bicuspid valves prevent backflow of any fluid, the lymph fluid, if you will. They're considered hybrid vessels because they also will absorb interstitial fluid, just like the lymph capillary will. They also they are a conduit for the lymph to travel down to collectors. The collectors are down here horizontally. One thing that you'll notice is here's a pre-collector that goes to a collector, and then here is another one, number 7. It goes through the fascia. So the perforating pre-collectors perforate through the fascia and they'll engage with deeper lymphatic vessels and collectors. Whereas the superficial ones will just go to the superficial collectors here. So this is where we have just a transfer of this fluid going towards the collectors. And that's really what the key component to the lymphatic system are, these collectors, because they're the main functional part of the vessel that transports lymph to the lymph nodes and then to the veins. So lymph collectors are segmented, and you can see that in this microscopic picture. They are segmented here. These are the bicuspid valves here. And between the two bicuspid valves is a section, and this section is called a lymphangion. The bicuspid valves prevent backflow. The lymphangion has smooth muscle cells, and they have, we'll get to that in just a moment. They have muscles that we have classified as smooth muscle cells, but they have some interesting components to it. These sections here between the bicuspid valves is called a lymphangion, and the lymphangions will move the lymph fluid from one segment to the next segment in a peristalsis type of a procedure. So the collector is made up of 2 to 3 layers of muscle. What's interesting about this is most recent research is showing that these muscles are very, very, very unique because they exhibit both they exhibit smooth muscle characteristics, skeletal muscle characteristics, as well as cardiac muscle characteristics. So it's really a very unique muscle that's found in the collectors. You'll see that there are spiral shaped, or they go around the vessel here. And then there's also muscles that are longitudinal that gives it a structural integrity. So the longitudinal ones are for structural integrity, gives it tone, if you will. So we have tone to the collectors. And then the ones that go around, they're responsible for squeezing these lymphangion section to squeeze fluid from one section to the next. They're innervated by the autonomic nervous system. And so we have this peristalsis type of a pacemaker, if you will, and they're very responsive to the environment condition. So that autonomic nervous system, when it knows that there's excess fluid or excess waste products, it actually stimulates the collectors to pump faster with more amplitude and more frequency and higher frequency. There are these stretch receptors inside these vessels here. And in the tunica media is where we typically find them. And these stretch receptors respond to stretch. So stretch of the vessel, and that can be stretched from the outside. It can be a longitudinal stretch. It can also be stretched from the inside, the lumen of the vessel, as the vessel fills up with fluid. As it gets fuller and fuller, it will stimulate that stretch receptor to make it squeeze, all right, and move the lymph to the next section. So things like exercise and vessel contraction that aligns with it. So you have veins and lymphatic vessels are usually paired very well. And that contraction of venous system and arterial system will cause lymphatic vessels to contract, as well as diaphragmatic breathing and manual lymphatic drainage. As I said before, it's a peristalsis movement, but it's very slow. It's a slow rhythm and a low amplitude, and normally at rest. And so that rhythm, amplitude, that rhythm is called lymphangial motoricity. And that's what we call that rhythm. All right. Oh, and that rhythm is about, so every contraction takes about 2.88 seconds. So that's how long it takes for the contraction to occur. 2.88 seconds. So now these collectors are transporting lymph to the lymph nodes. And these lymph nodes are lymphoid organs. And these lymphoid organs store the lymphocytes, and they also colonize lymphocytes. So it's an extremely important lymphoid organ There are about 400 to 700 lymph nodes in the body. The key thing to remember is that they do not regenerate. So you may have heard of breast cancer-related lymphedema. This is because these lymph nodes, when they've done a lymphadenectomy or radiation to lymph nodes, and the lymph nodes are destroyed, they do not regenerate. And so we have 2 to 12 vessels coming in. Here's 1, 2, 3, 4 vessels shown here sending lymph into the lymph node, and only 1 or 2 leaving. That means if we take this lymph node out, these vessels have no place to send the lymph, and the lymph begins to backtrack, if you will, and need to find a different lymph node to go to. The more lymph nodes we have removed or damaged, the harder it is to find a way out. So then we get the backup of lymph fluid. So inside the lymph nodes, we have active filtration of the lymph by leukocytes and lymphocytes. And this is also where we have lymphocyte reproduction, if you will, or clonal expansion. They're making clones of themselves, if you will, in the lymph nodes. Pretty cool. The main nodal groups are in the viscera. About half of the lymph nodes are found in the abdomen, the axillary lymph nodes, the inguinal lymph nodes, and the cervical lymph nodes. Okay, so now we know that the collectors have transported the lymph to the lymph nodes. Now the lymph is going to leave the lymph node, and from there, what happens is these collectors begin to anastamize. They begin to anastamize with each other, and what happens is we get a large collector, and these large collectors are called trunks. And we have a few different trunks. There's the intestinal trunk, the lumbar trunk, the subclavian trunk, and the jugular trunk. You can see what they're responsible for draining right there in front of you. Now, those trunks will then anastamize to make a duct, and these are even larger collectors. So trunks and ducts are collectors. They're just larger, if you will. There's 2 main ducts. There's the right lymphatic duct, and there's the thoracic duct. The largest one is the thoracic duct. In a human cadaver, that we can see that it's about the size of your pinky or pencil, if you will. The right lymphatic duct is short and stubby on the right side there, and it only drains about 300 milliliters a day. About 1/4 of the body is going through the right lymphatic duct, whereas 2 to 4 liters is being drained through the thoracic duct, and that accounts for about 3/4 of the body's lymph. Where does the lymph go finally? So we have the right lymphatic duct here. We have the thoracic duct starting down here, somewhere around T11 to L1. And so you can see here that it comes up, loops around the thoracic inlet, and then it terminates right here at the angle of the veins. And so the angle of veins is really important, the venous angles here on both sides. And this is where the lymphatic system terminates. The lymph fluid then mixes with the venous blood, and then it goes to the heart and then gets pumped to the organs of elimination. The venous angle is made up of the subclavian vein and the internal jugular vein. Okay, another thing that might be of interest to you is that the superficial lymphatic system is divided by watersheds. Watersheds in nature is where water divides. And so that's a linear border between territories. And so we divide the lymphatic system into territories, but this is superficial, right? Or suprafascial would be a better way, above the fascia. And that's how we divide the lymphatic system. And where that becomes important is where we're treating lymphedema, because there are some collectors that cross these watersheds, if you will, and it governs our rerouting treatment for lymphedema. So where does lymph drain to is the question. So we've talked about a lot of the lymph nodes already as far as the main nodal groups. And so what we can see here is that the upper extremity and upper quadrant drain to the axillary nodes. The lower quadrant and the lower extremity drain to the inguinal nodes, and the head drains to the cervical and clavicular nodes. All right, so here's what's fun. So we've talked about the lymphatic system, the anatomy. But I want to talk a little bit about that. The anatomy of the lymphatic system is not just underneath the top layer of skin. It's not just in this dermal epidermic junction. It's actually deeper. So we have suprafascial lymphatics, but we also have subfascial lymphatic vessels as well. And we're going to see all these structures, the lymphatic capillaries, the pre-collectors, the collectors. We're going to see all those structures deep as well, including periosteum, muscle, tendon, all these structures are going to display lymphatics. So let's take a look at some of those. So, by the way, a lot of these illustrations that you see in this PowerPoint are from my book. And so that's the ones that I'm using here to illustrate the different lymphatics. So you can see here the lymphatic system of the periosteum and the bone here, and the lymph fluid or interstitial fluid as well is traveling through the Haverson canals and the Volkmann's canals, and then traveling out towards the periosteum where we have a rich presentation of lymphatics. In the joint capsule, I love teaching about the joint capsule because in the subsynovium is where we have a rich presentation of lymphatics as well as the microvasculature of the capillary network. And what you can see here is that this is where we actually will get reabsorption of synovial fluid. The lymphatics themselves are solely responsible for absorption of synovial fluid. In PT school, we always say, exercise is great for production of synovial fluid and then it gets reabsorbed. But it was never explained, well, how does it get reabsorbed? Or how does it get absorbed? And it really is solely dependent upon the lymphatic system for absorption of the synovial fluid. Muscle, all the way down to the primary bundle, we get lymphatic capillaries. And so the muscle is rich with lymphatics. And so it is extremely important for healing of the musculature. You have peripheral nerves have lymphatics around them. You can see here that the lymphatics are definitely around the epidural tissue here. So you have the epidural lymph vessel here. You can see also here the paralymphatic arachnoid villi, which lies close to some lymph nodes in the intervertebral foramen. So the intervertebral foramen have lymph nodes around them. These paralymphatic arachnoid villi are also a component of the lymphatic system. And so the cerebral spinal fluid will leak out of these arachnoid villi and then be taken up by the lymphatic capillaries there and the intervertebral foramen lymph nodes. And then, of course, we have the central nervous system. We have some lymphatic vessels that are responsible for absorbing the cerebral spinal fluid. So the cerebral spinal fluid is not a closed system. It actually leaks in the intervertebral foramen, those areas where the nerve roots are, as also by the cribriform plate, and we have the areas of the pharynx and the nasal septum that are really important for absorbing the cerebral spinal fluid in those areas. We know that there is cerebral interstitial fluid. That cerebral interstitial fluid will then navigate and towards these areas called perivascular spaces or Virchow-Robin spaces. And this is where it mixes with the cerebral spinal fluid. And then we find it its way towards lymphatics. As I said, the cranial nerves is another area, the cribriform plate, the pharynx region, the deep cervical lymph nodes, all responsible for helping get rid of waste products from the central nervous system. There's some great literature out there right now that's showing that lymphatic drainage techniques have been very helpful in decreasing the waste products that are a result of hemorrhaging in the central nervous system, such as cerebral vascular accidents, CVAs. It can be very helpful in that as well. So something to keep in mind for practice. We also find lymphatics in the viscera. One one new study that's really of interest to me is how the lymphatics are right along with, right next to the arterial structures of the heart. And they are suggesting that the lymphatics, because we said already that the lymphatic load is responsible for getting the fatty acids, so it's actually helpful in reducing atherosclerosis. So lymphatics have a strong component. A healthy lymphatic system for the heart is really important for reducing atherosclerosis. A pretty neat study out there that's suggesting that. There's lymphatics in the kidneys, and we know that they have been useful for decreasing the presence of kidney stones and getting rid of waste products in the kidneys is what's really important in the lymphatic system of the renal system. We find them also in the pulmonary system. So all kinds of different applications for the lymphatic system in many different ways. All right. So I am going to check here. I want to check on my time here, make sure I'm doing good. And I am. So I want to make sure we get through this. So we're going to give you a little snippet of physiology. I'd love to go through more. If you ever want to go through more physiology in the lymphatics, would love to, as far as it relates to edema as well, the different types of edema. But I think it's important that you know what's really coming out. And it's not necessarily new. It's actually been around since 2010. It's something called revised Starling's equilibrium. And it's actually really, really important for the lymphatic system. The revised Starling's equilibrium really talks about that microcirculation. And I'm going to go through this fairly quickly. We know that in the microcirculation, we have filtration, and maybe you've heard that there's also reabsorption. And we would say that that blood's going through the arterial end of the capillary and we get filtration. And then on the venule side of the capillary, there's reabsorption. Things are coming back into the vein. And somewhere in between is this division between these two components. Well, Starling did his work a long time ago in the 1800s. Things have changed quite a bit since then. And so what we now know is there is a very unique structure in the capillaries, the glycocalyx layer. And what it does is it actually separates the lymphatic system as far as what its main purpose is. So what we have here actually is we have all filtration through the capillary system. So it's not filtration and then reabsorption. It's just in the arterial end, there's a lot of filtration. On the venule end, there's a little bit of filtration. So what does that mean then? So that means that there's really no absorption of fluid on the venous end of the blood capillaries. And the blood capillaries filter fluid along the entire length into the interstitial space. And so that means that the removal of interstitial fluid, all right, depends entirely on the lymphatic system. And so what's really cool about this, because we have this endothelial glycocalyx layer, is that it's all about the lymphatics. And so that's why I get so excited about the lymphatics. And it's not only because it's really cool from the anatomy and physiology, but because we can do manual lymphatic drainage to that. So there's manual lymphatic drainage, and I want to make sure that you understand that manual lymphatic drainage is not a massage, it's not effleurage, it's not petrissage, it's not tapontin, and it's not myofascial techniques. What it is it's a manual technique based off of Emil Vatter's 4 basic strokes. And I say based off of because there's a lot of different tenets or different schools of thought in how to do manual lymphatic drainage. They have different words for it, but the main components are still the same. The main components is that all strokes are bidirectional. They go perpendicular to the vessel, and then they go directional in the direction that the lymph should be going. All right. It also specifically targets the lymphatics. It is a a microcirculation technique, if you will, because in some regards, what we're doing with the lymphatic drainage is we're targeting those anchoring filaments and those collector stretch receptors, and we're moving the interstitial fluid around and spreading it around so that it can engage more lymphatic capillaries. And so when we do that, it effectuates the lymphangiomotoricity by increasing the lymphangiomotoricity, the rhythm and the amplitude of the contractions. And then it also has an effect on the autonomic nervous system. So in general, what manual lymphatic drainage does is it increases lymph production, it increases lymphangiomotoricity, it increases venous return, it absorbs edema, water, it absorbs protein, it absorbs waste products and hyaluronan. It has an analgesic effect. It has a local sympathetic stimulation. And when you have it done on yourself, or you do it to someone else, it's very relaxing. So it has a parasympathetic response as well. Now I know that they sound like, oh, this sounds like it's too good to be true. It's amazing. Wow. Where's the evidence? Well, I have that for you here. Where is the evidence? So one of the things I've been doing just recently, because there's been uh, some negative talk out there a little bit in complete decongestive therapy world about manual lymphatic drainage. And I wanted to go and look at the evidence. And so I have a running list of articles, and I'm going to continue to build upon this list. It's basically a rapid literature search and a rapid abstract review. This is not a systematic review. This is not a meta-analysis. This is just me going through the literature, pulling up some literature, showing, putting in the abstract, what their findings were, and showing that, yeah, manual lymphatic drainage is really a great technique. It does so many things. It's so great. And I hope that maybe you'll take a look at this list, and maybe it'll tickle your fancy, if you will, to get involved in lymphatic drainage, whatever tenet there that you would be interested in. There's so many different schools out there that teach different ways of doing it. They're all good. I don't really think one's better than the other. I think that lymphatic drainage is good. Both the light touch, the deeper touch, as long as it's bidirectional, and we're going proximal to distal, and then distal to proximal, we're going to get benefits, and we're going to see people improve. So basically, that's it for my lecture. I wanted to make sure that I had a little bit of time to just show a couple of different things that you can do for yourself. Don't forget that I have my lymphatic drainage book here, Manual Lymphatic Techniques for the Orthopedic Manual Therapist, and take a look at that. So let me stop my share here, and let me just show you a couple things. First things first, the best manual lymphatic thing that you could do is just deep breathing. So breathing deeply stimulates the lymphatic system. Want to make sure that that's really important component that you do. So you can do 5 deep breaths. Let's do those together. Let's do 5 deep breaths in our nose, out our mouth. And make sure when you're doing that, you're really getting different pressures in your thorax and your abdomen. But I tell you what, that felt good after talking so fast for so long. All right, the next thing you're going to do is you're going to place your fingers right here, right above your clavicles, in a nice hollow space there, this hollow area called the thoracic inlet. I just want you to push down into this inlet here, the thoracic inlet. And you want to go nice and slow. Your pressure is firm. You want to press down so that you're trying to get into the thoracic inlet. Nice and slow. We'll do that a few times. It's recommended that you do these stretches and these techniques 5 to 7 times, but you can do it 10, 15 times if you wanted, but a minimum right around 5 to 7. All right, so after you do that, you're going to take your hands, you're going to put them on your neck, and I want you to take your hand, I want you to stretch the skin back towards the back of your neck and then stretch down. It's bi-directional. So posterior and then inferior. Posterior, inferior. You can do that together. So posterior, inferior on the sides of your neck. Posterior, inferior. And it should take you around 3 seconds to do each stretch. As I said, the contraction is about 2.88 seconds. The next area, you're going to place your fingers right behind your jawbone and underneath your ear, and you're going to do the same direction. Posterior, inferior, posterior, and then inferior. And really what you're trying to do is just stretch the skin. It's not a muscle massage. That's not what we're doing here. You can do lymphatic techniques to the muscle, but right now what we're doing is just stretching the skin over the fascia. So just enough pressure to stretch the skin over the fascia. You don't need to go any deeper than that. Okay. And then place your hands on your cheek here. And what you're going to do is you're going to go superior and posterior. Superior and posterior. So these areas that we've done so far have a lot of lymph nodes and lymph vessels that's going to the lymph nodes, to and from the lymph nodes. And that can really stimulate your cervical lymph nodes area. It can help decrease headaches. It can increase some energy levels if you to your day. You've been on the computer for a long time. Just doing 5 to 10 strokes in each location can really help give you a boost, if you will. And then let's just do 3 more deep breaths. And I think I finished with enough time for a couple questions, Justin. So I think that's good.
Terrific. Thank you, Dr. Doubblestein. That was wonderful. I do actually already have a question or two from the chat, so I will read those off for you.
All right.
Thank you. My question is, are there any actual video evidence of lymph fluid actually traveling from the lymphatic vessel into the venous system? I found a videography of the lymphangian pumping, but I've never seen video of lymph being transferred from the lymph vessels to the veins.
Yeah, so I've not seen a video of that. I can tell you that it is naturally occurring to go to veins. In fact, if you look at the literature about the microsurgery for the lymphatics, there are studies that show that it does naturally occur sporadically to veins. Naturally, that can happen. It's not a very frequent thing to go into a vein in the arm or anything. It mainly returns to the venous angle, and that's where we have it mixed with the blood there. Is there a indocyanine green study video presentation of that at the venous angle? I'm not aware of a video of the venous angle. I'm sure maybe that would be something to look into, and maybe someone will do that.
All right. Thank you. The next question I see here is, are there any lymph nodes in the brain, and if so, where?
Not in the brain. There's no lymph nodes in the brain. The lymph nodes are going to be in the deep cervical spine, deep cervical region, as well as the superficial cervical region. So not in the brain. The brain basically is getting rid of waste products to the cerebral spinal fluid. So all those waste products that the central nervous system is making, their cells too, and so they're going to make waste products. It goes into the cerebral interstitial fluid. That cerebral interstitial fluid then migrates to the cerebral spinal fluid. And then from there, the cerebral spinal fluid will then make its way to the lymphatics.
Okay. And a few more here. What causes fluid retention? Or other than direct trauma, what causes a sluggish lymphatic system?
Okay. So that's a loaded question. There's different components to that. I think maybe I'll start at the end and work my way backwards. What can cause a sluggish lymphatic system? There's a couple of different things that can cause a sluggish lymphatic system. One is just inactivity and obesity. We know that there is obesity-related lymphedema, and so that we know that obesity definitely will result in a sluggish lymphatic system. The other thing that can cause a sluggish lymphatic system is chronic edema. Chronic edema will cause a sluggish lymphatic system as well. These are a couple different things. And then at the beginning of that question, what was the beginning of that question? There was another component to that. I want to make sure.
Yeah, what causes fluid retention?
Okay, so there are many different things that causes fluid retention, and I think you pointed out other than trauma. So fluid retention can be due to systemic complications such as congestive heart failure. There can be mixed edema. So that's a loaded question that I wouldn't be able to go through each and every one of those different pathological conditions, but there are many things that can cause that. So.
All right, very well. This is the next question here, is if you could please briefly review the directions for the three techniques you just mentioned.
Directions are bidirectional. So I'm gonna just kind of give a quick way of stating that. So basically, the idea is the lymph vessels are going to drain towards the heart, right? And so if you keep that in mind, that the lymph vessels drain towards the heart, that's going to be the direction that you want to send lymph. Then basically the idea is that you need two directions. You need to go across the vessels, so that's perpendicular to the flow. And then we want to go with the flow, which would be parallel to the flow. Whether that's left, right, it doesn't matter. If your perpendicular direction is back or backwards or posterior or anterior or forward, that doesn't matter. Just do one or the other. And then the next part of that is you want to send it where the lymph is going. Where's the lymph going? It's going towards the heart, or it's going to go towards these venous angles. So it's really a simple concept, but it does such amazing things. So make sure that it's just bidirectional. Your first one is perpendicular to the vessels, and this second one is towards the venous angles. That would be the easiest way to do that and make it easy for you.
All right. Thank you. And the next question here, and we're getting close, but I do have just one more. Can congenital lymphedema be healed completely or just treated with MLD?
Congenital lymphedema. Congenital lymphedema is managed or treated with manual lymphatic drainage, but it also requires compression. So it requires both aspects. And one of the main things in addition to that is good skin care, because a lot of individuals with congenital lymphedema do end up having cellulitis infections. And so it's important that if you're going to be treating a lymphedema, that you get the training to learn how to treat lymphedema, and not just learn how to treat lymphedema, but to know all the different aspects to lymphedema. So make sure that you get the training for that, that would be my recommendation.
Excellent. Thank you. So, as Dr. Doublestein had mentioned a few times, his book that he's authored, Manual Lymphatic Techniques for the Orthopedic Manual Therapist. We do have that available. Maybe maybe tonight you're just starting to learn about lymphatics, and it'd be great there. But either way, we have it available, and I want to put this in the chat. It's $79.95. I'd be happy if you prefer to email me if you'd like to purchase a copy. Please do. I'm just going to put the link to the book. And also I will excellent. Thank you for the details. And also at this time, I always like to say we don't have any type of eval process. So if there's anything you wanted to put in the chat for Dr. Doublestein, that's a good way to do it. I just want to make sure I've saved this chat just in case there's anything there I need to come back to. So there you go. Manual Lymphatic Techniques for the Orthopedic Manual Therapist. And you can purchase that with us, the Upledger Institute International. Again, feel free to email me as well. I'm very happy to help with that. Now, if you're here and maybe you are someone who needs help and you're looking for a therapist or hoping for a therapist, we have manual therapists at iahp.com as our database. Feel free to go to the database, click on Find a Therapist, and then you can search your location. All the training and completions and information for our practitioners on there will be listed. I am excited to say that there are 30,000 people a month using our database, iahp.com, to find help. And hopefully many of you are helping them. And if you need help, hopefully it's a resource for you to go to and use for yourself as well. Wanted to let you know about upcoming In Touch segments. Excited to announce that on Tuesday, May 28th, it's 7 p.m. We'll have Adrian Bean presenting how adding Baral neuromanipulation will improve your practice and the health of your clients. That again will be on Tuesday, May 28th at 7 p.m. You can register for that online. Our team is emailing. You can always just email me. I always like to emphasize if you're at a presentation you couldn't finish, or you're seeing this later and you're seeing it as the recording and you say, wow, I missed some of these wonderful presentations I could have access to. Email me, Justin, Justin .Vogel, that's V as in Victory, O-G as in girl, L as in Larry, at IAHE.com. I'm very happy to send you those recordings. If you're looking to register for future events, I'm very happy to help you with that. Now, I'd already mentioned Adrian Bean's presentation on May 28th. We also have The Secret Life of Fascia with Bruce Schoenfeld, which will be Tuesday, September 24th. 7 p.m. And then Finding Wholeness After Trauma, the role of craniosacral therapy in supporting recovery for trauma survivors with Monica Hamer. That's October 22nd. As you can see here, we may add something in June, but usually we take a little summer break. We go with that. And one final thing, as I mentioned, the recording, we post all of our In Touch presentations to Facebook, our Facebook page. The Upledger Institute International page is the links there for you. If you like the page, it's a great way to stay connected with us. All things manual therapy, craniosacral, visceral, Upledger, Baral Institute, anything we have going on, we're keeping you informed. So I hope that's helpful. I am going to hand it back over to you, Mr. Doublestein, and you can have the final word. I thank you so much for spending some of your time with us and educating us.
Absolutely. It was my pleasure. I hope that those in attendance were at least stimulated to know more about the lymphatic system, maybe get involved in some education about lymphatic drainage techniques that are out there. And I would love to come back sometime and share more and maybe demonstrate some more for you about techniques and go over physiology. It's the love of my life. It's been that way for many years. So I look forward to continue to do research and expand the knowledge of what a great system and the techniques that are involved. So thank you so much for having me.
Awesome. Thanks again, Dr. Doublestein. Thanks everyone for attending, and feel free to reach out to me if you have any additional questions we didn't get to, or if you'd like to order a copy of the book. Thank you so much. Take care.